We've all had surgery, and I read something that said like 60 to 75% of people with Crohn's will have some sort of surgery, and about 20% of colitis patients have some form of surgery. But we've all had some form
of it, yeah.
Most of us more than one as well.
Yeah.
I've had three.
Yeah.
And I know before I had my first surgery, I was really scared. I'd been in hospital for a couple of weeks, and they'd been trying to get it under control with steroids. I'd been on the tablets for a long time, and then they tried to get me under control by having the IV steroids. And it got to the point where it just wasn't doing anything at all. And my surgeon came in to talk to me and said, this is your option now. You can either go on to different medication, but I think you're going to be under the knife at some point in the future. So shall we do it now?
Yeah.
And so I did. So I had a sort of a weird mix between relief, because I'd been so poorly, I was away from home, I was really missing my kids, and absolute terror because it was just completely unknown, and the Stoma nurse came to see me in hospital, and they give you all the bags, and you sort of get a little bit of an idea of it, but I don't think...
Because once you know that it's going to happen,
yeah,
you've got a bit of time, haven't you, to make...
Oh yeah, I was straight on
it.
my phone, sort of searching the internet, reading some terrible horror stories. So, and I think it's a lot better now. There's a lot more people sharing their real experiences.
There's a lot more out there,
and then afterwards, it was very hard. Even though I'd had some preparation, I know some people go straight into emergency surgery. For me, it was planned, but I very much felt almost like a mourning of the life that I was going to have, and also just a missing organ. I know that sounds weird, doesn't it? Did you have that?
Not so much, no. I think because I was, obviously I was rushed in, I was an emergency, so obviously I'd had colitis for years. It got to the point where I'd been on so much codeine, so much iron tablets, that I'd actually now got to the point where my bowel was going to rupture, and that was due to the fact that obviously my meds weren't really being watched closely enough. So when they told me actually you're really severely constipated, I was like, really? Like, how can that happen? I'm still going to the bathroom 15 times a day. And ultimately, as you said, I'd never met this surgeon before, but he came to my bedside and he said, well, same sort of thing, that you're going to end up under the knife. You're now at the point anyway where it's toxic. We need to get it out of you as soon as possible. If I give you infliximab, which was a drug that I couldn't obviously have due to funding at the time, he just said that nothing else is going to work, no amount of steroids, so let's get you down to theatre. So obviously straight away I was whipped straight down to theatre, and then it was all quite quick. There wasn't really much time to think,
same as me.
If that makes sense.
I'd been at home for maybe a couple of months, everything seemed fine. They'd tried me on various tablets, but nothing was working. It just ended up being I was on more painkillers than anything.
Exactly.
So I went in for a check-up, and they realised, you've got decisions, mate. We can try it for another month or so, or we can have you down to surgery within a couple of days. And looking back, it was good that I made that decision, because
the best decision.
I was days away. That's it,
Definitely.
I was days away from a serious
same.
operation, so it made sense at the time.
And how did you feel afterwards? Did you deal with it okay?
It was weird, because I'd never been in hospital at all in my life prior to this. So I'd gone from nothing to being in there for months. So it took a long time for me to get my head around it. But as soon as I came around from that surgery and the pain was gone, you just knew it was the right decision to be made. It was totally worth it.
I
always used to say it's like a bag or a box, because at the end of the day, that's the decision.
That's it,
it's one or the other, because actually, ultimately, it's life and death, and
absolutely.
As morbid as that sounds, it's true.
I think sometimes there's such a negative view of people who've got an ostomy, but for everyone, it wasn't a choice. It wasn't something that we thought, this is fantastic. It was
extra.
It was the option between not being here at all or life with a bag. And I definitely found life with a bag a lot easier than life with the illness.
Without a doubt.
Yeah, for me, when I had to make the decision about my rectum and make my bag permanent, it was a relief. And my first surgery was emergency. There were no Stoma nurses on at all, because it was a Sunday morning and it had to happen, and I didn't have time to feel anything. But then 2 months down the line, I was actually crying for my colon.
Yeah.
I was like, is life always going to be like, fatigued because I've been so poorly? But my actual proctectomy surgery, like when I had my rectum removed, it was a relief because it's hard to explain, but I was so poorly with the inflamed rectum that when my bag was made permanent, even though I've had subsequent surgeries, it's been a lot easier to have the disease with a bag than without.
Definitely.
So, I tried everything and it was the right decision for me, really.
I think for everyone, most people I speak to, when they weigh up the negatives and the positives, everyone tends to say that it was the right decision for them at that time.
Looking back in hindsight, I think if we all had that, had to make that decision much earlier, and say carry on with meds or continue, obviously, and have the surgery and have a stoma, what do you think you guys would have done? Like, do you think that you would have gone for that at that stage? Or
I think, personally, I think I did make the right decision. Yeah. I mean, like you said, you had few quite serious surgeries I've been through, but everything that I've had, I probably had 4 major surgeries, but then I've been down to theatre probably another 30 times with complications. And even with all those, I've still made the right decision. I'm better now than I would have been without it.
Yeah, I think I had colitis for 10 years, so it was managed really well on medication for a long time, but it definitely had got to that point where I had to put my trust into the NHS and into the surgeon, and I'm pleased that I went with it when I did.
Yeah.